wonderful. And last week topic was so interesting that we got calls from our friends and partners abroad that we reminded them of the pidgin when they were back here in Nigeria. They enjoyed it. We felt probably we went too hard using our native, our Nigerian vocabulary. But notwithstanding, they still enjoyed it. I know very well that all those that came in from Nigeria here were at home with the pidgin. And thank God we learned so many things at that lecture. And today we'll be going into something yet again very interesting. And my brother from Chilaka will be joining me for us to, just throw more light on the fat or pot belly tummy. Fat or pot belly tummy. When people carry this big tummy about, in Nigeria here we see them as well-to-do. As a matter of fact, in Nigeria, you are not considered rich if your tummy is not protruding. They see it as a sign of good living. So if you have money and your tummy is not showing, probably something is wrong. So yet again today we'll get to know whether having this big tummy is a good thing or whether it has a medical risk. Hello, can you all hear me? Can you all
Yes, sir. We can hear you, sir. We can hear you loud and clear.
Thank you very much. Because I know some of us that are listening to this. Please just bring a little look at your stomach. Just look at your stomach. Will you consider yourself having a big tummy, a pot belly? Please just look at your tummy. If your madam is there, maybe your madam will help assess the men, and the men too can assess the women to know whether they have pot belly.
Yes, no.
Now overeating the ground.
It's okay. Now, if you look at the picture in front of you, you will see a particular man, an African, of course, by his color. He's not on pants, but his front is covered. You can see how big his tummy is. This is a man that belongs to the Budi tribe, B-U-D-I, in Ethiopia. As a matter of fact, this African, in their own culture, it is believed that you are not a man when your tummy is not protruding. So you can imagine there are cultures in Africa where to have a protruding tummy is considered wealthy, is considered opulence. In fact, you cannot even get married in that culture if your tummy is not big. So what they do in this particular culture is that before they even have a festival, the Big Belly Festival, where the men come out to showcase how big their tummy is. And how do they get this tummy to be big? They put them in tummy fattening rooms where they are fed with blood of cows mixed with honey and the milk of cows. And these men will be there taking this meal consistently for 6 months. And by the time they are coming out of that belly fattening room, their tummies are all protruding. So today we'll get to know whether it is healthy or whether it is not. Please just be patient enough to follow my drift. It is not only the blacks that have protruding tummies. The whites do too, pot belly. So it is a global phenomenon. As a matter of fact, WHO estimates that 12.8% of Africans have pot belly, and the global estimate is put at 13.1%. Now, studies that were done in Nigeria showed clearly that men, around 26.3% of Nigerian men have pot belly, while 28.3% of our female folks in Nigeria, they have pot belly as well. So if you look at the statistics in Nigeria, it appears the women have overtaken the men, but most times you find more attention being given to men, especially when the topic of pot belly is mentioned. Statistics and research, 10 studies, as a matter of fact, 10 studies done in Nigeria, the women were still topping the list. So we are going to ask ourselves this question. Please just give me a minute. What is belly fat? When we talk about pot belly, all we are referring to medically is fat in the belly. Fat in the belly. So what is belly fat? So in this lecture, we are going to know what belly fat is and even where these fats are situated in the body that makes it to enlarge, so to say. Now, by definition, a belly fat is the excess adipose tissue that accumulates beneath your skin. It is the excess adipose tissue that accumulates beneath your skin. Now, one thing we must take away from today's lecture is that everybody has fat. Everybody has fat. Now, it all depends on how it accumulates and how it begins to expand beneath the skin. Now, one thing we must understand is that there are two particular types. As a matter of fact, for those who may not know, once they see a big tummy, a big tummy, a protruding tummy, the assumption is that they are all one and the same, irrespective of who is carrying that or those protruding tummies. But in today's class, we're going to look at two types. We're going to look at two types of belly fat. We have the subcutaneous as well as the visceral belly fats. We're going to see the difference today. What is subcutaneous? If you look at the term subcutaneous, it means beneath the skin, deep beneath the skin. If you look at your skin right now, you'll find out that you're staring. If all of you can just look at your skin, maybe your hand or your legs, you will be staring at the epidermis or the epidermal layer. Then beneath the epidermal layer, we have the dermal layer. And beneath the dermal layer, we have the hypodermal layer or subcutis. Now, if you look at that term subcutis, that particular section, there are fats because that particular area is where we refer to as the subcutaneous layer. There are fats there. So everybody has fats in those areas. But depending on habits, because we are all born, and once we are born, we inherit this fat. We are born with it because it has its own duties. But habits, environmental habits, can begin to expand on this fat. So we have this fat within the subcutaneous area. This one, you can easily feel it. If you look at women, if they raise their arm just beneath the arm there, you see some women, they find fats. Even when they shake it, you find the whole thing wobbling. Some men, you can just hold the flesh of their tummy, and by the time you shake it, you find it wobbling. They are loose. So you can easily see this type. Why? Because they jiggle. So you can easily identify it. For some females, you look at their buttocks. The same thing with men. You look at their buttocks. You find it, jiggly. And you can know that these are excessive fats that have accumulated beneath the skin, the subcutis layer, or where we refer to as the subcutaneous region. Now, what this means in essence is that just like I said earlier, a lot of environmental factors play a role in an individual having this subcutaneous type of belly fat. One, an individual that is deep in eating all manner of junk food, where food is the in thing with this individual. You find some people, they just can't do without food. They eat at all times, irrespective of time or hours. They just eat. They just keep on eating. And most times, these same people seldom do exercise. Some are into alcohols and so many other life-threatening conditions. And once they do this, the more you engage in this kind of habit, the fats around the subcutaneous layer begins to expand. Let me show this class today a diagram for us to really get it clear. Now, if you look at the young boy before you, because we equally see small children that are obese, where they constantly eat. You go to most of these so-called rich men or rich women homes and you see their kids. You find them bigger than their peers. Why? Because of constant eating or drinking of non-alcoholic beverages and sometimes even alcoholic beverages. Because why? It is available in the home. So if you look at the subcutaneous area of the belly, you can see where the fat is, just beneath the dermal region, around the subcutis. So you now find the one in yellow from the diagram you're looking at in front of you. So now you know where the subcutaneous fat can begin to expand. And once it begins to expand, you now find the person's belly protruding. Why? Because the fat there is expanding. Why is it expanding? The habit of the person. I've mentioned some of these habits, and I'm sure some of you listening to me, you are even engaging in some of those habits, and that is why Madam can look at your tummy and say, Daddy, this tummy here. Now we are seeing reasons why your tummy is expanding. The fats in the subcutis are expanding. Now, in men too, we have equally observed that as they grow older and their testosterone level drops, you now find that it tends to cause them to lose muscle mass. So, and this is enough to kind of make them to develop some level of fat. But in their own case, it tends not to be as much as those that are lesser in age. The second one is the visceral fat. For visceral fat, you seldom see it. You seldom can identify it with the external eyes. Why? Because it is deep within the organs. Around our organs, there are fats. Let me show you a diagram that will help us to understand where a visceral fat can be found. Let's look at this diagram. Let's assume a human being is divided from the stomach region into two equal halves. Now, if you look at the diagram in front of you, you will see the liver, you will see so many other organs of the body that have been divided for you to see. You can even see the intestines as well. Now, if you look at this diagram, the viscera fats are all, hello, can you all hear me? Hello, can you all hear me?
Yes, we can hear.
We can hear you, sir. We can hear you. But those people are making noise. You should shut them down.
Please, the other, yeah, thank you very much. Now, if you look at the fats, these fats that are embedded around these organs that you cannot see or visualize with your external eye, these ones are the ones referred to as the visceral fat. As a matter of fact, if this particular type keeps on increasing, it poses a serious danger and health risks to the patient. serious health risks to the patient. Now, you find out that since this particular type of fat surrounds your abdominal cavity, they surround vital organs such as your liver, your pancreas, your intestines. As a matter of fact, the more this fat begins to increase, it increases your risk to all manner of diseases, especially type 2 diabetes. And one thing that can really make this visceral fat to expand is one, irregular exercise, junk food, the same thing that makes the subcutaneous fat to expand. They are the same thing, alcohol consumption. Are you getting it? So you find out that all of these can expand. So if you are engaged in regular exercise, if you monitor the type of food you drink and you limit your alcohol consumption, then it will go a long way in reducing to a larger extent your visceral fat. Please, I'm sure all of us are getting it. So if you see somebody with a protruding tummy, the person has high risk of having both subcutaneous fat as well as visceral fat. At least in today's class, we've been able to know the difference. The Buddhi man that we saw, the black man, on our first slide, whether we like it or not, that particular man has both, whether we like it or not. He has both subcutaneous fat as well as visceral fat. Now let's continue. How does these two fats play a major role in determining how we look? So this next slide will be helping us. I'm sure looking at the diagrams in front of you, some of you listening to me right now will be able to identify some of our Nigerian brothers and Nigerian sisters that look like these shapes in front of you. Please, somebody tell that baby to be quiet. Thank you. Now, if you look at the first one in front of us, this type has accumulated fats in such a manner that the full upper part of the body, the first diagram you're looking at, we call it full upper body fat. So the person fat have enlarged right from the neck down to the belly. So right from the neck to the chest, to the belly, round to the back, everything is swollen. The fats are all enlarged. Now, we see this type of fats, especially with men and women who are engaged in overeating, people who eat a lot and do not have time to exercise. And most times, most of the food they eat are sugary foods and junks. If you look at women that sits down to fry puff-puff, buns, and all of that, if you look at those women, you can tell how the fat has covered them right from their neck down to their legs and enlarging their tummy. So you can easily identify this type of persons when you see them. We call this full upper body fat. The second one is the one where it is only the lower abdomen that has the fat, where the lower abdomen is protruding. The chest looks normal. The upper part of the abdomen looks normal. Only the lower part is protruding. When you find a human being with this type of fats, you will know definitely that this particular person is highly stressed. Stress is one major causative agent for this type of lower abdominal fat. Depression is another factor, and anxiety. So when you see somebody with a lower abdominal fat, the upper part is normal, the chest is normal, only the lower part is protruding. No, this is very, very abnormal. The third one here is the person has a large stomach and the back too is equally protruding. It's as if he has a tummy at his back. He has a tummy in front and what looks like a tummy at the back. we see human beings like this too. There's fat, large stomach fat in front, and another fat at the back. Now, when you find a man or a woman with this type of tummy or body fat, just know that this person is having inactivity in his or her life. This person is not engaged in any activity at all. And he's only engaged in those things that will constitute making the belly fat to expand. The fourth is the type we call the lower body fat. We see this a lot with women, where the top from the neck to the chest to the belly, everything looks normal, only for the person to enlarge from the waist downwards. So you now find the person from the waist downward, everything there is fat. But the head, neck, chest, everything looks good. So we refer to this as lower body fat. Now, people who eat lots of food that has gluten, especially bread and whole grain, we see this a lot in Western Nigeria. Please pardon me for our Western brothers and sisters. We see this a lot in Western Nigeria, lower body fat. We equally have another one we call swollen stomach. You think the woman is pregnant, yet she is not pregnant. You see the man, you begin to think whether the man is pregnant for his wife, but the man is not pregnant. Now, this type of swollen stomach, you just see it round. As a matter of fact, these are people that are engaged in excessive alcohol intake. Excessive alcohol intake. So I'm sure you can identify one or two persons out there. Then we equally have what we call lower body fat, including lower legs. Here, just like the lower body fat, the thing starts. But while this other lower body fat that we talked about, that we said is as a result of excess gluten, stops at the knee. In the case of lower body fat, including lower legs, the fat extends to the lower part of the leg. It goes beyond the knees. So you find the person swollen from the hips down, even down to the legs. Meanwhile, from the hips, from the waist upward, the person looks normal. So I'm sure all of us listening today would have seen this type of persons around, and we should be able to identify them. Now, another thing we must learn again is that what causes visceral fat. I had told you earlier that we are born with fat, so genetically we are born with fat, but environmental factors can determine the amount of visceral fat you collect. It is genetics that determine your body shape, but your environmental behavior, what you do outside after birth, as soon as you begin to grow up, will determine which type of this fat we have just mentioned that you are having. Excess sugar, carbohydrate food help increase visceral fat. And one danger is this. One thing we must understand when we talked about the other fat that we said is stress related. One thing with stress is that it activates a hormone in your body called cortisol. And one thing with cortisol is that it activates your body's fight or flight responses. One thing we must understand is that if you look at the autonomic nervous system and you break it down, we have the sympathetic nervous system as well as the parasympathetic nervous system. While the sympathetic nervous system is engaged in preparing you for fight or to run in the case of danger, the parasympathetic helps you to relax and to sleep or rest. Now, one thing again is this. Somebody who is stressed up, the more you activate this cortisol, the more the hormone produces this cortisol. It keeps this person under constant tension and stress. Are you getting it? And if you're engaged in habits that will make cortisol to be increased, that is why you find most people who are engaged in this habit are very aggressive. They are very, very aggressive. And that is signs that there's a lot of visceral fat in them. Why? Because cortisol is one hormone that can lead to increased visceral fat. So please, if you are listening to me and you know you are still engaged in alcohol, please, I want to beg you. The reason why Super Life Nigeria is bringing this topic to us weekly is to see how we can be helped so that the life expectancy that has been given to Nigeria, which is still less than 50, we can go above it and far beyond 70 and live healthy lives. The next one is what causes subcutaneous fat. I had told you earlier that our environmental factors a lot, habits, lack of exercise, the type of food we eat, how often we eat, play a major role. And this is a predisposing factor that can lead to diabetes. For some of you who missed our lecture on diabetes when we had it, please go to our online platform and go back and listen on the lecture I gave that we gave on diabetes. You will understand that most of the environmental things we do can really lead to different types of diseases. What are the dangers of excess abdominal fat? What are the dangers? One thing we must understand is that there are so many chronic illnesses that can develop. I will allow my farm, when he comes, to dive into that when he will be talking about diagnosis and treatment. There are so many chronic illnesses that can develop. We've looked at some. And another thing again is one thing we must know, those with we've seen cases where those with high abdominal fat have poor libido, very poor libido. And even if it is considered a big man's structure, most people will not find out from these big men the diseases they carry with it. So please, if you are hoping to have big tummy and move about like a rich man, be prepared to carry the diseases of the rich. Now, what are the roles of diet and exercise in abdominal fat reduction? One thing with diet is that we have been saying it oftentimes that if you cannot eat good 3 square meals a day, then eat more than 3 in minimal quantity so that your body will be able to digest and your body will be able to absorb. The basic thing here is digestion and absorption. And please do your part to engage in regular physical activity to burn excess fat, so that you don't begin to accumulate. Lack of inactivity creates fat. So the reason why I'm rushing is to give us enough time so we have regular physical activity, embracing a balanced diet, ensure you have stress management, ability to control your stress, and ensure that you sleep very, very well. A lot of people find it difficult to sleep. Sleep is very, very paramount. It helps your body break down, carry out digestion. Why? Because the parasympathetic nervous system is in action, and as a result, it will go do its work.
I see your wife called this morning. But
so please, somebody should mute that lady. Thank you very much. So please, at this point, I want to invite our farm Chilaka, to take us through some of the diagnosis and tests. There's a way you can know that you have body fat. I left that part because I want our farm to handle it, and he will look at some treatment measures and ways medical personnel are helping to reduce body fat. Please, farm, are you there? Hello, farm.
Yes, sir, I'm here. Good evening, sir.
Yeah, farm, you're welcome. Please, you have the floor. Thank you very much.
Okay. Good evening, everybody. Good evening, Prof. Thank you for this privilege to be here this evening to co-hosts, belly fat. Last week we looked at flatulence, and then we saw that medicine, like we use in our local palace, it's okay, but it could be problematic if not handled properly. Okay, so tonight we'll be looking at belly fat or visceral fat, and then we want to see quickly how to get rid of the visceral fat. How do you diagnose it, and how to test for it? Okay, so just like Prof has said earlier, he had mentioned a hormone. There's a hormone called cortisol, and that cortisol is responsible for the activation of the fight and flight response. It activates that action, and when that action is triggered, there is a buildup or a storage of certain fatty acids. Cortisol itself is also in a way stimulated by fat. So when you look at it, it is about fat. So it activates certain signals that will lead to build up or storage of fatty particles or fats, or visceral fat as we call it, and that could pose a problem. All right, so how do you diagnose? How do you diagnose? How do you diagnose? Or how do you test for this? So basically, the HCP, the healthcare providers, which include the doctors, the nurses, even the sometimes the lab scientists, as the case may be, right? One of the things that guides their approach or their diagnostic technique is to calculate what we call the BMI. The BMI, that is the basic mass index of that patient, or you call it the body mass index, the BMI. Now, in order to do that, we need to also know that there's a ratio of fat, usually is the mass, the total body mass, or the total body weight. So what I'm saying in essence is this: if, for example, you are weighing 80 kg, your visceral fat would be 10% of 80 kg. That means, and 10% of 80 kg is what? Is 8 kg. Am I communicating, please? So it means that your visceral fat is 8 kg. Now, if the normal, so if the normal body weight you should have, vis-a-vis your age is exceeding your weight range, your normal weight range. If, for example, you are supposed to be weighing between 70 and 80 kg for your age, also your height, because in calculating the BMI, All right, we used the body weight over the square of the height of that person. Why the height is important is because if you are calculating the weight of a person, you are looking at the entire body weight, and you know that your bones make up close to about what's it called, about 50% or more of the entire body mass. So that is why the height is important. So you notice that people who are taller or who are tall, supposedly, should weigh higher.
That the guy presenting.
That is from like the pharmacist.
Look at him.
Should weigh higher. So, for example, if you have two people, one's height, let me say A and B. Mr. A's height is say 1.84, 1.85, which is about 6 feet tall, right? And Mr. B has a height of say 1.73. Do you understand? All things being equal, let's assume that they eat the same kind of food, they are in the same working environment, they eat the same diet and stuff like that. Expectedly, the Mr. A, who weighs 1.84 to 1.85, should have a higher BMI or should have a higher weight to weigh higher, simply because he is what? Taller. It's as simple as that. So it is important that we look at these factors. That is why we use the BMI. So the BMI, although it is not 100% accurate, because there are certain factors that could actually distort the value. For example, you don't expect a woman who is pregnant, especially her body weight should go higher, should increase because she's carrying a child. A woman who has just given birth expectedly should have an increased body weight. So if you use her BMI at that time, it might not be entirely correct because of the circumstances surrounding that moment. But all things being equal, like I said, the height of the person is very important. So while calculating the BMI, again, I said, is what? Is the weight, the body weight divided by the square of the person's height in meters. So BMI is simply kg m raised to power minus 2. That's the formula. That's the SI unit. So let me give you an example now. Let me use, who will I use now? Mr. Sampson. Let's assume Mr. Sampson's body weight is, say, 80 kg. All right? And his height in meters is let's say 1.5. His height is 1.5. Mr. Sampson is not short though. It's 1.5. So if Mr. Sampson his height is 1.5, what will not be his BMI? His BMI will be equal to 80 divided by 1.5 raised to power 2. So the BMI of Mr. Sampson, if you have a calculator there, can calculate for me, will be 80 divided by 1.5 raised to power 2 is what? Is 2.25. So 80 divided by what? 2.25. That will give you the value of Mr. Sampson's BMI. Now, there are certain ratios that we now use to know if this person is actually at the risk of having visceral fat. So, like I said, so let me give you the analysis here. A person who is having a BMI, all right, an average adult having a BMI of below 18.5. When the BMI is below 18.5, it simply means the person is underweight. So there is an increased risk of what? Having certain health issues, because whether you are overweight or you're underweight is a problem. when we're talking about heart diseases, stroke, and all that, myocardial infarction, right? We did mention that hypotension, which is the opposite of hypertension, that it is as deadly as hypertension. And so what the body needs is everything to be normal. To be normal. Like we said last week, there's nothing wrong in fatting. Fatting only shows that you're healthy, right? It is normal. You're eating, you should fat. But when you now begin to fat excessively, you begin to have what we call gastritis, or you fat uncontrollably, especially when your fat is very pungent and smells like a dead human being or a dead animal, then it calls for concern, right? So, but if you are also not fatting at all, it's a problem also. It shows there's a problem. So the same thing is applicable to your body weight. If you are overweight, it poses problem to your health. If you are also underweight, it's even more dangerous. Because if you are underweight, it could be that you don't have calcium, you lack calcium. It could also be that your bones are weak. Because like I said earlier, the height or the mass, the bone mass is a function of the body weight. So because the skeleton make up about 50% of the body weight. So if you have if you're underweight, it quickly informs the HCP, all right, that this person could be suffering from some bone problem, bone disease, or malnutrition. All right. So if the BMI, please note this, if the BMI, you can write that down, is below 18.5, then there's an increased risk of health problems. If the BMI is between 18.5 and 24.9, okay, let me use myself for example. You can calculate for me if you have a calculator there. Let me see if I can do that here. My body weight, as at the last time I checked, is 77. Although I know by now it would have gone lower than that because we are fasting, and it's very good to fast. We have 100 days to go to fast, and I think today was just day 21 or thereabout. Now, if you divide my height is 1.84 in meters. I'm just about 6 feet and 1 tall. Now, if I divide my body weight 77, so that you know if I am healthy or not, or if I have a problem with my BMI. 1 minute or 1 second. Let me get my calculator. So I have 77 as my body weight, right? And then I divide it by 1.84 raised to power 2. I get 22.74, which is approximately 22.7. So this, by God's grace, is a perfect BMI, is a good BMI. Because if your BMI is between 18.5 and 24.9, then you have a normal weight. You are not overweight and you are not underweight. So there is least risk, very little risk of any health complications associated with fats. And you know there are a lot of health hazards, health problems associated with visceral fat or fats generally. All right. So you can be doing that on your own to calculate yours. If you know, I know my height. I think everybody here you should know your height. If you don't know your height, you can check that up tomorrow. Go to the pharmacy or go to any place. They tell them you want to check your height. You may not even pay anything. They will do that for you. You should know your body weight. That you should know. You should be checked. You should be tracking your body weight at least intermittently, periodically. Know your body weight is important because that's the only way you can actually get your BMI. So, for example, now if you are weighing 80, let's say somebody here is weighing, okay, let me say 80, and your body and your height is let's say 1.75. So 1.75 raised to power 2 is 26. So it means that this person is already overweight.
So you will see that the higher your body weight, the more likely you're going to have a high or a higher BMI. So you see, the body weight plays a very key role. But again, your height is also important. And so you look at these two variables, all right? So if you are also between 25 and 29.9, that is overweight. You can write that down. There is an increased risk of developing health problems. So patients who have their visceral fat higher than the 10% ratio usually fall within this group. They fall within this group, and even much more. So if you are also having a BMI, remember I said BMI is your weight divided by the square of the square, means multiplying your height by itself by the same number. So if the height is 1.7, you multiply 1.7 times 1.7. That's square. So if the BMI is between 30 and 34.9, now the person is in the first level of obesity. We call them the obese class. That is the first group of obese class 1. That person has a high risk of developing health problems. If your BMI is between 35 and 39.9, then you are in the second group of people called the obese class 2. Please note this, that from the group of overweight to this one I'm talking about now, they are already at a high risk. There's a high risk. So, but if you are in obese class 2, 35 to 39, you are at a very high risk. Then if you are at obese class 3, where your BMI is higher than 40, my brother, this one is extremely, extremely, extremely high. And I see a lot of them at the hospital. I am telling you this. You don't want to see them. A lot of men, you will see them with their big belly. A lot of them come down with infertility issues. They can't perform. They have erectile dysfunction. They have a lot of chronic problems, especially diabetes. This is not a good thing. In those days, we used to think that the biggest men or the big men are the ones with big tummy. I look at Chief Namali, our boss here, looking very fit. There is no pot belly. I don't think you are richer than him. Look at Bill Gates, Elon Musk. These are billionaires. What's this guy's name? The guy that owns Amazon. These guys are fit. There's no tummy there. So in those days, we see young men who would drink 10 bottles of beer. Their tummy is expanding, and they say they are rich, and that is true. It is a fallacious thought, and we all thought so. So when a man has big tummy, he's rich. No, he's alive on the pit of hell. You don't have. My father in the Lord is very fit. He's 83 years old, and he's very fit. Does not have fat, big tummy, and all that. So I had to list out this BMI category so that we can, on our own, if there's anything you must have learned from this lecture this evening, is to know how to calculate your own BMI yourself. You don't need anybody to do that for you. Just know your body weight and know your height. You get your BMI and know the category you belong. So if you are not in the class 2, where you have the normal weight 18.5 to 24.9, there's a problem. So we need to take this very, very seriously. Okay, so let me go back to so I can quickly round up after taking time on that. I had to take my time to explain that so that we get it clear. That is the basis of our discussion tonight. All right. And so there are also a few ways you can measure your body fat. All right. Now, just you can do that on your own. You don't need anybody to teach you that. One is the weight measurement. A lot of us who have sewn clothes, we have visited tailors, right? Just go to a tailoring store. You don't even go to the tailoring store. Get a tape. All right. wrap a tape, you call waist measurement. Wrap a tape, around your waist. Round your waist, not your hip. Round your waist. If your measurement, if the size of your waist for a woman is higher than 35 inches. If it's higher than 35 inches, your waist, not your hip now, your waist, if it is higher than 35 inches, then it is something you should be concerned about. For a man, for men, if it is higher than 40 inches for your waist measurement, then you should be concerned about that. You should be concerned about that because most of the visceral fats, you find them around the adipose tissues around the waist region and then your abdomen. So if the waist is increased in size, it is a very good indicator of a higher level of visceral fat, or an increased amount of visceral fat, and then it's called for concern. Another thing you can also do is your waist to hip ratio. The waist to hip ratio measurement is also what you can also do. It's very easy. Get a tape rule, all right? You have done the first measurement, which is the waist measurement. Get the measurement of your waist, get the size. And then take the tape downward to get the measurement of your hip. The hip size normally should be higher than what? Your waist size. Because the hip has a hip bone that should expand or increase the size of the hip. So if you take the rule or the tape downward, it should be higher than your waist size. And so divide your hip size by your waist size. If you have that division, for example, your waist size is say 34 and your hip size is 40. If you divide 40, excuse me 1 minute please, 35 divided by 40, you will get 0.875. Excuse me please. 0.875. That is not too good, but it's also not too bad. You understand what I'm talking about? 0. Because if for a woman, if it is 0.875, then it's a problem. So it means that if your body weight, if your waist measurement is 35, your hip should be something like maybe 45 or 44. When you calculate it, you will get something below 0.85. Once it is below 0.85, then you are fine. Then you are fine. If it's also below 0.5, 0.5, that means there's a problem. It means that you don't have the hip at all. And then why would you have a hip at all? Why would your hips be so small that it's smaller than your waist? Do you get what I'm talking about? Again, for the men, if it is 0.9, if you measure your waist, I know my waist is around 33 or 34. So if I take the tape down and I get my hip size and I divide my hip size by my waist size and I get something about 0.9 or above, it means that there's a problem. It shows that there is fat in my waist. Because if there's fat in your waist, that's the visceral fat. You will definitely get a higher coefficient. So once you are getting around 0.9, it means that there is a closeness. There is a closeness between your waist size and your hip size, and it shouldn't be. There should be a significant difference. If the number is approaching 1.0, that's a very big problem. It means that your waist size is already at par with your hip size, and it shouldn't be. If it crosses 1 point something and above, then it shows that your waist size is now higher than your hip size, and that's a very big problem. That's a very big problem, because normally, if you look at an ideal shape for a woman, when you look at figure 8, why is it figure 8? That place that goes inward, that is the waist. It should be smaller than the hip and the top. So if the other side down, which is your hip, is significantly higher. Sorry, if the waist is now at par, even higher than the hip, then there's a very big problem. And you will notice that the person will not have a very good shape. That's not a good shape. So even the visceral fat will not even make you have a very good shape. You understand? It's not something like you should go and start having a depression on. The essence of this lecture is for us to get this information and try to live a healthy life, because there are certain things you don't need doctors to do for you. You know, these are things we can sit down on our own and find a way to cope them, to manage them. You understand? Fat is not something that is difficult to manage. It only requires discipline. All right, discipline. When you go to the hospital, you see a lot of young men, young women, especially men. It is even more among men than women. Most women come down with this problem postpartum or post-delivery. That's when you see them increasing in fat, which is not so bad, except when it becomes unmanageable. You understand? But most men, the man is not giving birth. You're not producing kids. So why are you growing? What's happening? Why is your weight growing so big? Why is your tummy looking at you have 3 kids inside? So the problem is even actually more on the men than the women. I'm talking about women who are still within, who are within child, who are still, giving birth. All right. I'm not talking about the woman who is not giving birth. If you have not given birth and you're having a large waist size, then it's a problem also. But I'm talking about an ideal woman who has started producing kids. So it's normal for you to have an increased waist size, but it has to be managed. But if you have not given birth, or you're a young man, you're having this kind of problem, then it calls for concern. Then there's also what we call the waist height ratio. The waist height ratio, all right, I'll talk about the BMI. The waist height ratio is also dividing your waist size by your height. So for example, my waist size is 33 or 34, and I divide 34 by 1.84. Whatever value I get, that is the ratio. All right. So if that ratio is higher than 1.5, higher than 0.5, all right, there's a problem. It should not be higher than 0.5. You're below it, whether you are a male or you are a female. If your waist height ratio is greater than 0.5 in men and women, that's a problem. So how do you manage it now? The best way to lose the visceral fat, how do you treat it? How do you manage this problem? The best way, Prof has said that repeatedly, is that you need to do exercise. Exercise. The best way to lose fat is by exercise. A healthy lifestyle. And one major healthy lifestyle is exercise. I can never overemphasize the importance of exercise. Exercise. I'm saying that repeatedly. Exercise. A lot of us will live a sedentary life. We are so docile. We don't go out. You don't go out. You don't walk out. You don't do any of those. You just sit down in your office. AC is blowing you. You get into your car. AC handling you. You get to your house. AC. You don't have time to move around. I told us some time ago that even if you're in your office, for every 30 minutes, you must learn to stand for 5 minutes. Every 30 minutes of sitting down, you must stand up. For example, if I start sitting at 8 a.m., it means at 8:30 a.m., I should be up standing for 5 minutes. So between 8:30 and 8:35, I should be standing. You can't be sitting down like that for a long time. And sometimes activities, our jobs, our work, family affairs will not even give us time to do this exercise. Even the Bible recognizes it. That physical exercise profited little. At least that little gain is something. It's something. You need that exercise. All this going to take this or take that, take one thing, take one that, you take this, you take that, all those things. See, exercise is still the most effective way. It's what we call HIIT, high intensity interval training. When you involve yourself in some kind of aerobic activities, you don't have to go and carry body weight. That will just beat your muscles. You can decide to walk from let's say from mile 2, you walk to second rainbow in first star. You know what I'm talking about? You can walk, and if you walk for 15 or 20 minutes, spend 5 minutes to run. Something speedy. You do that, you wouldn't even know that you're losing weight. You wouldn't even know. It is slow and gradual, and it's healthy. It could take you for 1 year. It will take you for 6 months, but you will not even know. Somebody else will be telling you, you're coming down. Oh. What's happening? Look at your tummy is going down. That's why you don't know that that thing is paying off. Because when you start it, the first few months, it will look like you're wasting your time because it's painful. And no pain, no gain. It has to be painful for you to get the benefit. A lot of people they want shortcuts, want something you will take and to kill all the fat. A lot of them will give you problems. If it is not natural, you end up giving yourself, you're looking so amoebic, the shape is not there, because you are trying to use a fast cut. Most natural methods always take a while. If you want to manage it, they will tell you at least 3 months, at least 90 days. That's when you start seeing the effect. Because you can't, it is not orthodox. It's not something you have malaria, you take anti-malaria, and in 30 minutes you are fine. No, it doesn't work like that. A lot of times those sharp, fast cut processes will always lead you to one problem or the other, because the damage took a while. So the recovery time or the repair time should also take a while. Am I communicating? I think I've taken too much time. Let me wrap up quickly, sir. So eat healthy. Another thing to do, eat healthy, eat good foods, eat dairy foods. We talked about dairy foods last week, all right? Eat fruits, vegetables. When we say vegetables, it's not just ugu. You know what I'm saying? There are a lot of vegetables. Veggies are there. Nice fruits. These are all veggies. Nice leaves. And they are all around us. All around us. I met a lady some time ago who said she could manage any kind of health problem. I said, how? She said God has showed her all the leaves, all the plants she could lay hands on and solve various health problems. And she was giving me her success story. And I was impressed. Even though I'm not really, I'm not into trad medicine and all that. But I also appreciate the fact that she was able to recognize what nature has naturally given us, freely given us. But these things, you can take them without, you don't need to be sick to take them. Take vegetables, eat right. Eat right. I visited, God should forgive me. We went for a sales conference, some time ago. And we saw, it was a tradition blue, and so we had some foreigners, white people around. When it was time for breakfast, now, see these white guys, just eating lettuce and some kind of funny leaves and fruits and juice. I said, nah, this guy, on the buffet, that as I entered there, I first started with the egg and the bread. After I finished the bread, I ran to the tea. After I finished with the tea, I moved to the rice. That's the black Nigerian for you. So, but I also know how to burn them out, basically. So, but the point is, it was not a healthy way of eating. So we should learn to eat right. It's as simple as that. Okay, and then what other things can we do? We also need to sleep well, reduce stress, limit the consumption of alcohol. Prof have mentioned that. I can't overemphasize that. Alcohol, stop that. If you want to live right, want to live well, want to live healthy, just cut down and stop it. It does not add any value to your health. It destroys it. It destroys your liver. It destroys your kidney. It doesn't add anything. So why would you keep indulging in something that does not add 1% of value to your health? So discontinue anything alcoholic, because most of the food we eat are actually alcoholic. You eat the rice, at the end of the day, it's alcoholic because it's carbohydrates. And when you like, if you're a scientist, you know what I'm talking about. When there's glycolysis, at the end of the day, there's T-cell cycle. You have a lot of these some kind of anaerobic respiration within certain cells, and then you're still going to have alcohol at the end of the day. Sometimes that's why sometimes when you throw up, you will see that sometimes your food smells like alcohol when you're throwing up, because it goes on in your system. So there is no reason why you should not go and take extra again. You buy all those things and you take them. All right. So these are just basic ways. So how do you now techniques for fat loss? Number one, okay, I've talked about intermittent fasting. This one is very key. Like we're doing now, hydration is also very good. Taking water makes you look full, and so you can't eat as much as you'd have wanted, and that helps you to reduce fat intake. Liposuction, this is a surgical solution for those who have money, who can do all that. You can go to the hospital and they will get the fat out of your system. But it is also not, of course, we have a lot of success stories. Success rate is high. But why go through that means? Why go through that means when you can actually just eat healthy? Okay. This is liposuction. Okay, that just showed us now. And these are structures of people who have, the belly fat and before and after the surgery. So yeah, we have a lot of success rates, but I also advise the best and the most effective way is just live a healthy lifestyle, which is eating right and exercising as much as possible. Thank you very much. I'm sorry for taking your time.
Let's
Thank you. The farm, thank you, Dr. Rove. I think we want Samson to come on board.
Yes.
At least.
Yes, and then talk on the Super Life products that we have on the screen and how it can be helpful with belly fat.
Hello, Coach Samson, are you there?
Good evening, everyone.
Good evening.
Super Life.
Life is super.
Life is super. I want to use this medium to really say a big thank you to Dr. Rose and Farmer Chilaka. Sorry to say this. I used to say it in your absence. Farmer, you are my hero on this platform. And the reason is not I'm trying to be biased. The reason why I said you are my hero when on this platform is because we're talking about products, and when it comes to drugs, pharmacists are the author. I don't want to say they are finisher. I don't want to equate it to Jesus Christ. So they are the experts when it comes to drug, and so that's why telling us, all this, and it's a really wonderful thing. I really appreciate you. You've done a very wonderful job. A lot of things today you do. Even me, I don't have the in-depth knowledge of how to calculate all these things. You have done a very wonderful job. John Abba, please, can you please always mute your mic? So, from Chilaka, you are my hero. I really appreciate you for the wonderful exposition and expository, lecture you have given to us. I'm telling you, you are once in a million. Thank you very much. And Dr. Rose as well for all the medical analysis, and the academic exercise. We're in school, or we don't know. All of us are in school. And I'm telling you, I don't know when you're going to graduate. You're going to give us certification. Thank you so much. So let's quickly talk about super life products that you can use to, tackle or solve these challenges we have discussed tonight. Like, thank God we'll be discussing this. Some of us that will coming to our seminar on Tuesday. A lot of you will not be alien to all these measures. We used to discuss it. That all these measures, that your diet is not complete without exercise and without fasting and without proper hydration. I used to say your diet, any diet you are doing, is not complete without fasting, intermittent fasting, which are what I preach as well, and exercise, physical activities, exercise, and also proper hydration. So you should note this. So that's why you see that even in our products, almost of our products in Super Life, we always encourage you to be properly hydrated, because we know the impact of proper hydration in your metabolism. Because the problem we are addressing tonight is the metabolic issues, particularly even also the last one we treated last week is the metabolic issues. That means absorption and breaking down of your diet. If it's not proper, then you start accumulating on water cholesterol. And one of the hormones or that is or cells that is responsible for these menace is called the cells of the adipocyte. That is why Super Life, in their own wisdom, everybody, can you just say, thank you, Super Life. God bless Super Life. Say it, please just type it in the chat box. Say, God bless Super Life. I remember when SEC Plus
Thank you, Super Life.
was first
God
being
bless Super
manufactured.
Life. Thank you, Super Life.
Yes.
God bless Super
Yes.
Life.
God bless Super Life.
Just type it. Please, just type it in the chat box. So that we will
God bless
not
Super
be
Life.
obstructing the seminar. So what am I trying to say? Remember, before we have SEC Plus is our second product after SEC 30, and that is SEC 15. But later, in their own wisdom, because they discovered that the issue of fat and obesity is becoming challenges, instead of digestion, metabolism has become a very serious issue. And one of the reasons because of our diet, because mostly in the entire world now, a lot of compromise. There's a lot of compromise when it comes to diet. The kind of food, because of the GMP, system being bringing to, we are no longer eating healthily anymore, and this is really causing a lot of metabolic, issues. And they now say, in their wisdom, they now, enhance SCC 15 and call it SCC Plus. And the plus there, because the previous one has about 12 ingredients. 12 ingredients was composed of SCC 15 that time, and they now added another one that make it plus. The plus you see there is another added advantage, another added ingredient, and that ingredient is called Sinetro. Sinetro is a combination of citrus, all kind of citrus, lemon, orange, and all kind of citrus. That is what is the Sinetro. And what really amazed me is that Super Life, because they don't want to compromise the quality and the standard. That's why we say it's a premium product. If you know, SC15 used to be the most expensive product of Super Life. Even now, after Super Cell Tech is number one in terms of price, then followed by SCC Plus, even than SC30 and other products. What am I trying to say? So they went all to go and partner with a company in France, because that company was the one that has that formula. That's Sinetro, because that company is the company that specialized in that formula that they want to add to SCC15 to make it SCC, so that it can help to handle the issue of fat burning or obesity, or this is what we are treating tonight, or processed stomach. And that Sinetro, it is the plus in their SCC Plus. And what does that Sinetro does? And when the farmer was talking about burning fat, It's not about buying all manner of slimming pill. I was telling the people on Tuesday, I said a lot of people have been misled, and rip off online. Like there's some people saying they're selling slimming tea, slimming, all those things. All those things are nonsense. It's not going to give you any result. Even if you get a temporary relief, I'm telling you, the aftermath will be even worse. The best way to manage, the fat really naturally is to control your diet, number one, also to exercise, to hydrate, and again to now have a formulation. Having been in these challenges, there is a formulation that can address the fundamental problem. But what is the fundamental problem in the accumulations of fat? Don't mind, some people say cholesterol. The cholesterol is not bad. Even fat is not totally, because we need amount of fat even in our body, and but excess of it is what becomes the problem. So how do we control? There is a cells in the system that control the balance of this fat in our body, and it is called cells of the adipocyte. And what does the Superlife product does? The SCC Plus work on the cells of the adipocyte to make sure that the cholesterol or the fat you are gaining, your body is not accumulating unwanted cholesterol that will lead to the protruding of your tummy or bringing a fat, belly and what have you, or the obesity. And also because of the other ingredient in SCC Plus, it is one of the best, concoction that is best ingredient for digestion or any kind of a colon issues. So your digestion is proper, is making sure that your body is accumulating only what is good, from all the diets you are taking. And the one that is not good, you throw this away. That's why if you are having problem of even fasting, like we treated last time, if you take SCC Plus, I'm telling you, you're able to go to toilet proper, because it will remove all those impurities from your system and regulate your colon, and make sure that you have an healthy colon that only accumulates the healthy fat into your body, or healthy cholesterol, and removes all unwanted cholesterol or impurities from your system, and you have a proper metabolism, or what you call proper digestion. So that's why this product is best for people that are suffering from indigestion, constipations, and what have you, and also the fat belly or obesity. So, and I told you, the main ingredient that makes it different or make it unique to other so-called fat burning or fat slimming pill or whatever you, is because this one works on the cells that really controls the accumulations of the water. So that is the cells of the adipocyte. And I remember when doctor was talking about the other time, the place of stress in accumulating fat. There is what we call, that's why in our diagram, in the Superlife, presentation we have in the diagram, the effect of oxidative stress. There is what we call increased cortisol, because that's an hormone. When there's an increased cortisol, this also will trigger all these challenges. So Superlife product make sure it regulates all these hormones and make sure they are balanced, because there must be a balance. Like Pharmaceutica said, you must not be too low and you must not be too high. There must be a balance. You make sure it balance the equation now in your column, in your system, in your digestion system, and make sure it's only what is good for your system that the body is accumulating, and throw the other unwanted one into waste. And that's why if you take our product SCC Plus, it's not forgetting. I want to say this, it's not forgetting. Meanwhile, it's not a product for you to go to toilet. No, it's not forgetting. But the only thing that when you take it, after regulating all your systems, your colon, your hormones in the system, and make sure that you don't accumulate unwanted cholesterol, you will be able to go to toilet freely and release the waste that is not is needed in your body. So that's why some people will take it and they will go to toilet. This is so amount of the impurity of that is in their system that is not a problem for them. So it's not forgetting. So you should know that. It's not that something when you take it, will go to toilet. You work according to how the condition of your column or your system is. So that is it. So, and we look at SEC, super root coffee also. We also, take this, also the roles in regulating in all this because of the ingredients that are being present in the SRC. We have the Tonga Thai, which is called India or Malaysian ginseng. We have the maca, that is a Peruvian ginseng, and we have the tiger milk mushrooms. All these ingredients have their medicinal or therapeutic properties that helps to regulate our system and make sure our system work at par. There is a balance within the system, and this will relieve us of unnecessary cholesterol, and we will not be able to accumulate fat in our belly that becomes a fat belly. So then the new product Estera has also come to also how do I want to put it? It's not a replacement. I used to tell people it's not a replacement for every other product in Super Life. It's just only come to complement the work of every other product that we have been using in our ecosystem. So it has because it also regulates what do you call it? It regulates our system, our immune system, also it's our circulations, and also our metabolism. That's why you see that if you want to use our Estera, it was advised that firstly you energize the water so that all the molecules that could aid proper digestion of your system, through that energizing of that water for 2 to 3 minutes, and you drink 2 cups of water before you start the therapy, and use it. And after also, you see the place of hydration there, because these ones will help to carry all those, into the blood and everything, so that to make sure there is a proper circulation in our system. So you see that Estera as well, coming to complement the effort of the SCC Plus and SRC in managing, or let me say, in solving the problem of prostostomy, or what we call the fat belly or obesity, for people, and also for those that are not addicts. You can also that's one of another advantage of this ecosystem of Super Life. It's not until when you fall into that category that you started using it. So if you don't want to have fat belly, having done your diet and exercise and other activities, you can use our SCC Plus and SRC and even the Estera to maintain your system, so that your body will continue to be at par, and so that you will not get to the level where you become the challenges to you, or they become an health challenges to you. Like I said, anybody having these challenges, I used to say it in the seminar, for you to having people that are obese and everything, there are conditions or factors that can make you to have diabetes, high blood pressure, and any other health challenges, because the metabolism issue is even kidney issues, because these are metabolic problems, and it can result to insulin resistance as well. So I think I will pause here. So all these products you recommended here, they can be of help in managing or in restoring your health back to normalcy if you use it as recommended by both our medical practitioners, having given us some tips of what we can do, and if you follow suit, in no time, you will get a maximum result. So thank you for listening.
Thank you, Coach Sampson. So thank you for really giving a highlight of this 3 product of Super Life. Yeah, I want to thank once again the Dr. Egbe and Fam Chilaka, and Dr. Chooks that is not here too. I want to appreciate. These are the medical experts that has been making themselves available free of charge, courtesy of Super Life. So please, can we go to the chat room and just give them 7 fire emoji? 7 fire emoji. They are just coming every Friday evening. Of course, you know, if this should be tagged to any amount of money that it should be. This Prof. Ebe, of course, you should know what it should be. But this wonderful information, we are getting it free of charge. Of course, the Holy Book said that my people perish for lack of knowledge. So, knowledge of the Word of God, knowledge on how we could manage our health organically. If people from the medical field who has been there, tutored with their whatever, can, from their heart, sincerely, letting us know the truth. So please, make sure that you maximize this opportunity. Practice it, use it for yourself. Let it be a blessing to you. It is only when it's already a blessing to you that it can now be, you in turn will be a channel of blessing to your immediate family and the extended family, then beyond. That is a way that Super Life World asks us to go, because the mission is on humanity. Super Life World believe mission before commission. We believe mission. The humanity is the mission. That's why the super health is the key. We want to return back to the nature. I want us to return back to nature so that all this killer disease that has been ravaging the entire world, you and I and our loved ones and well-wishers will be exempted by this information. And as many that receive the information and process it, you will be exempted. So that's why we don't even want to hold it Super Life products. You could hear now in the tonight lecture talks about exercise, intermediate fasting, hydration, having a very good regular water intake, what it can happen, the kind of health impact it will carry out in your system. Drinking regularly. Maybe one of the days we are going to talk about water, hydration. Maybe like the way Pharmachilaka, it gave us a calculation how to come up with the correct BMI. I've done my own calculation as he was saying, based on the formula he gave us now. So I'm looking for the next meeting or other one in the future, how we can calculate the minimum quantity of water you can take daily, minimum. There is a calculation for that. The same with your weight, with our weight, we'll get it. So once we have those facts and we begin to obey it, you will see that a lot of abnormalities in our system will begin to, it will begin to reverse. It needs to reverse for us to, our life expectancy to be what it should be. And by the time as we are getting it, our loved ones, immediate loved ones and the extended ones will be contacting it. It's contagious. The same way bad lifestyle is contagious. If you discipline yourself in a good lifestyle, it's contagious as well. So that is what we are, that's the message. And there is our own token to, in our corporate social responsibility, as the case may be. It starts even by members of Super Life in Nigeria denying themselves a robust bonus. They reduce it in order not to make that price to be too much, the package price. I want to let us know, please, to be a customer with Super Life, you are highly welcome. It is very important that you identify yourself as a customer to our company. Number one thing what it requires you to be a customer is just a valid ID card. For you to be our customer of to Superlife, valid ID card. And in Nigeria, 4 government ID card. Any of them is approved. Like NIN, if you have NIN, is well approved. Or voter's card, or driver's license, or valid international passport. If you have any of these, you are eligible to be a customer with Superlife World through us. Then the next one is your valid email address. Why that one is not an issue at all is that in the less than 2 minutes, you can create an email for yourself. Even if you don't know how to do so, someone closer to you can do so. Create a valid email address for you. Then other things follows. But the 2 major things is this valid ID card and email address. Then you will be connected to the company. The main reason why you have to be connected to the company, number one, it guarantees you getting the original products. I want to let us know that Nigeria has become a dumping ground of fake products of Superlife. Our country, Nigeria, has become a dumping ground. And since 2020, 2021, when they saw that this product is really a miracle product, it has helped a lot of health issues. A lot of people that have been to traveled outside this country on the best hospital in the world, and they could not access good health. As they came back, some of them even started using our products. They now restored, their health began to come back. We have so many testimonies. Now, many of our brothers and sisters have gone out of their way to import fake products. And that's the one that has been causing problem. You see some people, they start using the product, they say, what's happening? So please be guided, the source you are getting your products. We have 3 directors in Nigeria where you should get your product genuinely. We have Director Mama Patricia Onoja, based in Abuja. We have Director Akombi Esther in Benin City. And my humble self, Ambassador Kingsley Namani. I reside in Lagos State. So please make sure you reach out to whoever that is connecting you. Make sure that that person bring you to the system as a customer. Aside of getting the genuine products that will help your health or the health of your loved ones, there is another thing that the subsequent order that you will be booking, that order will be coming to you at company's discounted price. I've said it earlier before now, that if you check all the package prices worldwide, globally, Nigeria Superlife package prices still remains the cheapest. And it was deliberate. It was deliberate because we, the members of Superlife in Nigeria, chose to reduce our bonuses, the cash out of our bonuses, with over 1,000 naira difference per dollar. We discounted it. Let me give you an example. We know now that exchange rate is around 1,006, 1,007. But in Nigeria now, everything about it now is our bonuses is around 550 and 600. Now let's go by 600. If you minus 600 from 1,700, you could see that 1,100 has been discounted deliberately. And that's why our package price is very low. Even other neighboring countries, Ghana or whatever, many of them has been trooping to get it from us, but where we have seriously protected it. So whether a Ghanaian that is residing in Nigeria, a Cameroonian, as long as you are residing in Nigeria, you have access to this, our package price. You are that's part of our contributing to the society in our own country. So we have to start from where we are. That's our own government. And we have to do it well. And we know that God has been there for us. So once you have connected to the company, remember our products, all of they are therapeutic in nature. It's a therapeutic product. Now, it's not something that you say you want to buy one pack or thereabout. We need to know your health condition. By getting your health condition, probably you can even give us your scan result or test, any results from any lab that you have gone through. Our head of consultants, or even the manual that we have now, that manual is a doctor in your hands. That manual has gone to arrange all the ailments from in alphabetical order from A to Z. It was packaged by WHO consultants, headed by Dr. Chooks. So it has been a very wonderful handbook. So from that manual, everything that you need to know, the kind of combination that you need based on the ailments and the duration and the follow-up that comes after, please feel free to identify with us. Then even if to ensure that you meet up the dosage, which most often, depending on the ailment, could be 90 days. It could be more, it could be less, but at least the cycle is 90 days. But the moment you begin to use our therapy, the first 24 hours will convince you that indeed something that have come to restore your health has entered into your system. Within 24 hours, you will know. So then our team is going to be there to support you, because we are there for you that in a very short possible time, you might no longer require to look for money in order to continue the therapy. You will see the system generating some bonuses with the help of the team that you have connected with. So please feel free. Don't stand there and say how much. We are talking about health, life now. No amount of money that you can use to equate your life. We are there to support you, to assist you. And that's why we always advocate 80% support. We just need 20% of your commitment. Come and get this information through our Zoom meetings, through our physical meetings and other events, and you will see yourself. If you have anybody out there that are suffering, whether cancer, stroke, whatever, on any of these terminal ailments, please reach out to us. We are there to assist you. Thank you. So I don't want to go further. Time is fast spent. I want to please, in case if you have any question, the docs, the medical experts are still around. Please, can you kindly go to the chat room? Just drop your questions so that we'll use the next 3-5 minutes to attend to it. Just 5 minutes. Please go to the chat room to drop your stuff. So while we are waiting for you to drop your message, I want to encourage as many of our members, please, this year international trip. I don't want few members to embark on that trip. This year international trip, we have 3 outstanding international trips this year. Please, I want as many as possible who desire to at least to come and see what we normally have in Super Life International Leadership Summit. So we need to, I want to hold your hands as a director of Super Life in Nigeria and an ambassador of Super Life worldwide. Please give me your hands. Let me hold you. Let me show you step by step on how you can qualify. And you are going to embark on any or all the 3 international trips that we have this year. The first one is coming in May 2025, and that is in Malaysia. The company is asking us to come and see how wonderful Malaysia is, a very tourist country, and even to see the ultra-modern factory that this company opened, that should be 2023, something like that, yeah. So we'll go and see the factory where Superlife is bringing all these wonderful products. So that's in May 2025. Then in July, it's going to be in Thailand, in Bangkok. So please get ready. As many that desire this international trip, reach out to me, like I said. You will see that it's by helping others that a lot of things will begin to happen positively. Then the third one is in November, and that one is going to be in Turkey, Istanbul. That should be in November 2025. So any of these international trips, you desire to be featured in each and every one of them. Of course, being on that race, we make you number one. Of course, you are going to be product of our products, meaning that our product will reflect in your body. That we begin to, people will see you and say, what happened? Because that health, your health will be radiating. And once your health is radiating, of course, it is going to attract that wealth. And that wealth being attracted, you are going to have begin to have a very glorious lifestyle. And that one of those lifestyles is this international tours. So please, I'm soliciting for as many that desires it. And I want to go along with many leaders from Nigeria. Last year, South Africa took the lead. Those of us that came from Nigeria were not comfortable. Please, this year, we will prove to them truly that Nigeria, in anything that we want to do, we always come out in a very aggressive way to deliver. So please, let's make it a history. So I don't know if there is a question that is already in the chat room that we can give to our medical experts.
It's just about recording version. I've answered the person. I will be ready by next week. So you can go to our YouTube channel. You get the record version.
Okay. Please, if tonight is your first night, disturb the person that invited you in tonight's meeting to make sure that he submits your number, the one you are using for the Zoom, so that before next meeting, which is coming Friday, you are going to receive our usual incentive data. You are going to receive it directly in your phone, so that you will see that all of us, apart from those who are having network challenges, once we come into this workshop, we are not in a hurry to go because we have enough data that can carry us even beyond the meeting time. So we have been doing this for over 13 months now, supporting our members with 1 gig data. Please. And we said in case of Etisalat has been giving us problem. Yeah, please ensure you give other network except 9 Mobile, please. 9 Mobile, the network has been so bad. So as a lot of members that have 9 Mobile for their distance, it has not been easy to reach credit them. So please give us any other ones except 9, apart from 9 Mobile. Thank you very much. In our office, our Estera Tech, which is the new device, that is the game changer, the end of discussion. We have commenced a very wonderful workshop, and we call it, we have a very great, wonderful therapist in the house, a therapist that has been doing a very wonderful job. So in case if you are within Lagos State, please join us every Wednesday by 10 a.m. It's always very exclusive class, very wonderful. So we start by 10 o'clock. And this coming Wednesday, of course, is going to be demonstration where it's a full-time action. So please, then other states, depending on your response and whatever, we determine which state that we are coming next. That any state that we are coming, at least we are going to give you 3 days with your leaders. We don't want any of our members to handle that device in an unprofessional manner. That's why we want to take our time to train our members on the best way to use it professionally. And if you can use it professionally, all the ones that have used it, the first thing that happens to you, even while you are there at the spot, is a quality sleep. It delivers quality sleep. And it gets down, it helps to activate a lot of cells in your system. So I don't want to go there because we're already on the training. Once we are done with the training now, we are going to knock to every doors to show them this wonderful device. And that's the latest technology. It's a powerful ecosystem. So in absence of any question, I want to return the floor to Dr. Rove Ebe. Thank you. Doc, are you there?
Yes, I'm still here. Hello,
before we share the grace, yeah.
It's okay. I don't have anything to say. I just want to appreciate all those that have contributed and all those that join our Zoom lectures today. Next week we'll be coming up with another interesting topic, God's willing. So finally, I must give God all the glory for making it possible for us to have held our lectures today. Once again, thank you all for coming. We can share the grace now.
Thank you. Thank you. Please be your brother's keeper. Please, you know that if you invite 5 people here next week, each of them are going to receive incentive data. And I'm sure that 1 gig incentive data, this meeting cannot exhaust all of them. You still have extra that you can use for your personal stuff. So use that data to motivate your members and let them come and get a first-hand information on the best way to manage your health naturally. Because our products, our company is so much centered, prevention is better than cure. Prevention is cheaper than cure. So it's cheaper, it's far more economical. So that's where we want to stand on prevention first. If you and I should be able to prevent any manner of ailments early enough, I think it makes better sense. So see you same time coming Friday. God bless us all. May we unmute ourselves even as we share the grace in fellowship. 1, 2, go.
The grace of
May
our
the
Lord
grace
Jesus
of our
Christ,
Lord Jesus Christ, the
the
love
love
of
of God,
God, and the sweet
and the sweet
fellowship of
fellowship
the
of
Holy
Holy
Spirit
Spirit
be and abide
be
with
with
us
us
now
now,
and
now and
forevermore.
forevermore.
Amen.
Amen.
Surely
Surely,
God's goodness and mercy shall
God and
follow
mercy
us
shall follow me
all
all
the
the
days
days
of
of
our
my life,
lives, and we shall
and I
dwell
will
in the
dwell
house
in
of
the
the
house
Lord
of the Lord
forever and ever.
forever and ever.
Amen.
Amen.
Amen.